Hi, my name is Joanne Day. Today is July 29th, 2026. I'm currently a student at Chattahoochee Tech, and I'm enrolled in um, course ECCE 1103, Child Growth and Development 60253. My topic today is toddler biting. The two peer-reviewed sources that I used were NAEYC.org and 0to3.org. Today I'm going to be talking about why toddlers bite, how you should react to them biting, and the strategies to prevent biting. Children bite for several different reasons. Sometimes it's mostly in infants that it is related to teething pain. Often it's just experimenting or the need for oral motor stimulation where the infant may bite their mom while they're nursing, or if someone's holding them, they may bite onto their shoulder. But it's mostly not a bite of aggression. They are just starting to explore using their eyes and their hands and their mouths. So it's more of an accidental thing with an infant. As far as toddlers go, there's many reasons. They could be hungry, tired. They may just need to express themselves, and they express their feelings. They aren't really sure how to do that. Maybe they can't communicate. Maybe they're not talking yet. So you often hear of toddlers biting out of self-defense. How often have you seen two toddlers tussling over a toy and one of them ends up getting bit? So according to the National Association for Education of Young Children, you should never punish a child for biting. It doesn't help them to learn discipline or self-control. It just promotes the violence. You should never bite them back. You should avoid yelling and shaming them. And you shouldn't really give them a lot of attention. You should check on the child that has been bit, make sure that they're okay. Let the child that did the biting know that it's not acceptable and that the other child may feel sad or be hurt because of what they did. Try to teach them some empathy. Even negative attention towards them is not good, because that attention, some kids just need attention, and that attention causes them to bite again. Avoid labeling the child as a biter. Negative labels can affect how they view themselves. So that's not something that we want to do. So for strategies to stop the biting, one strategy that was noted in the article that I read in 0 to 3 is to try to identify signals of what causes them to bite. Like, try to kind of head them off at the path, stop the biting before it happens. You need to reinforce good behavior. You should help them to communicate their feelings. Maybe saying, tell Johnny that you're not done with the blocks. And I know when I did a lot of childcare in the past before I got into education, and I taught the kids some sign, because children who aren't speaking yet sometimes just cannot get across what they are trying to get across. And so if they have an outlet for being able to tell what they want, some of the things that they can tell what they want without actually using their words, that can help in the beginning before they're actually, more verbal. You can offer textured food to your children if they need to satisfy like a sensory issue. Although biting is not something all children do, it can be common occurrence in childcare centers and homes with several small children in them. So before I leave you, I want to just give you a little personal story that I had with biting. My son was probably between 2 and 3 years old, and he went to an in-home daycare. She probably had between 5 and 6 children. 3 of them happened to be little boys, my son and 2 other little boys around the same age. And the one day I went to pick up my son, and the babysitter said to me, keep an eye on him. We had a little incident today where he was biting. He bit another child. And I mean, look at this face. Does that look like a little guy that would bite somebody? Now, being a parent, I'm like, okay, he hasn't bit anybody before, but I'll keep an eye on him and I'll talk to him about it. So that was, that happened. And then a day or two later, I go to pick him up again, and the sitter said, I just wanted to let you know that it wasn't Ryan that was doing the biting. Apparently, today Ryan got bit and he had been bit on the shoulder, and they figured out it was the same bite marks as the other little boy that had gotten bit like 2 days before. And they were like, okay, so he's not the biter. And so everything was fine with that. And the other little boy, he was young and was struggling with, sharing and that kind of thing. And, he outgrew it. But it was just kind of funny that, as a parent, you think your child's perfect and that, oh, he would have never done that. And I didn't believe that. I thought, possibly he could have been upset and done that, but he had never done it before. So we just kept an eye on him. But yeah, he was not the culprit. So, but yeah, just keep an eye on them. And like I said, try to head them off at the path and see what you can do if they are a biter to help them understand their emotions and stop biting. So thanks for listening. Bye.